All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. It's 9:02 on February 26th. So thank you very much for being on this call, and thank you for making time every Monday morning to be here so you can always keep sharp in your craft as an agent. So we have some special guests on the line this morning from Gold Kidney, and they're going to share all the good news in just a few minutes. So stay tuned. But as we normally start here, let's start with our mission. We are here to improve the lives of our community with affordable healthcare. Thank you very much for being a part of that mission, and thank you for keeping your head down and moving because OEP is rocking and rolling. We're seeing some great success stories, and we want to share some of that and what the top agents are doing right now, so you can get busy earning, okay, and helping people. So that's what it's all about. As always, we got to keep one foot in the classroom and the other one in the field at all times. So I'm going to go ahead and share with you the training calendar for this week. And we've got some really great updates we're going to share with you in just a moment where things are going to get a lot simpler. So later today, we've got Humana. They're doing two trainings. These are 101 trainings for new agents in English at 2 o'clock and then in Espanol at 3 o'clock later today. So if you're new to Humana or if you need to brush up on your Humana training, that is today, 2 o'clock, or in Espanol at 3 o'clock. Okay. Moving over to tomorrow, Cigna's doing a live training at Centerwell. Those that were with us last week, Centerwell hosted a fantastic training in their beautiful facilities. It's in the same place. Oh, this one actually looks like it's in West Colonial instead. So they've got their own facility there on West Colonial. But thank you for all of you that did attend that training last week. It's very insightful. So Cigna's doing another live training. That's tomorrow at 10 o'clock in the Orlando market. If you are in that market, it's a great one to go to. Also, Humana is doing an OEP guidance and strategy course at 10 o'clock on Tuesday tomorrow as well. So if you can't make the Cigna, you can go over to the Humana one. Also, grassroots marketing training hosted by Humana as well at 4 o'clock tomorrow. We're going to talk about events this morning and all the great success that we're seeing from that. So keep that in your pocket. Wednesday, the 28th, 9:30 a.m., we've got our very own Al Clancy available to you for his virtual coffee and chat session. I have heard fantastic feedback from agents that are attending these sessions with Al. Your very own coach, your very own trainer, somebody that's going to be in your corner to help you and answer questions and help you get to the next level. You've got a dedicated hour with this man that knows what he's doing. So take advantage of it. Even if you've been in the business for a very long time, doesn't matter. Every time I talk to Al, I learn something new. So 9:30 Wednesdays, great opportunity to get in front of a coach. Also on Wednesday, 11 o'clock, virtual office hours for Cigna is there. Same time, Welker's doing their OEP kickoff, and this is in Espanol. That's at 11 o'clock. Looks like that may be for the Orlando market, so just stay tuned on that. You should have gotten an email about those events. DSNP training is also happening on Wednesday at 1 o'clock, and this is for the dual eligibles, the special needs plans for both Humana and Care Plus. So if you want to check that out, that's at 1 o'clock on Wednesday. Also on Wednesday, tips to retain your business, another great training available to you. Moving on to Thursday, the 29th, it's a leap year. We've got an extra day in February here. ACA training. So many of you have considered or have been thinking about doing ACA, or maybe you need to brush up on your ACA skills. This is our in-house training at HPM to help you with your ACA book of business. Very, very excited to have that going and hosted, I believe, by our very own Victor Crumity. So thank you very much for putting that together. We hope to see you there. And then March 1st, can you believe it? It's already March 1st on Friday. We've got HPM shop training at 9 o'clock. This week, we're actually going out to Connecture to meet and give them some live feedback on the software. So if you have any suggestions for us, please shoot us an email at support@askhpm.com or tell a teammate any ideas, feedback, anything that you'd like for us to improve on for HPM Shop 2024. which is our quote and enroll tool for Medicare Advantage. So it's there. That's the training for the week. Thank you very much, guys. Keep one foot in the classroom and the other one in the field at all times. All right. I want to talk about events today, and we've had some fantastic feedback at some of these events, and I want to share with you one of the pictures we got from over the weekend. This is our newest team member, Chan, on the left, and Rose Kofi, who has been an agent with us for a while, and she looks like she got her event sponsored by WellCare, and they're out there on the weekend with hundreds of people going through this. Looks like they went through like a run or a marathon, but they were out there, and I didn't see any other insurance agents out there at this particular event. And I can guarantee you that she's getting leads because she's always at the top of the production board. So if you're not out there, if you're not meeting people, if you're not doing events, you are missing a massive opportunity to grow your book of business. Okay. Rose has been doing it. The last time that I talked to her, she does up to 10 events a week. 10 events a week. Think about that. That's getting busy, right? I know some of you that haven't done 10 events in a year. And that's, if you're wondering why you're stuck in first gear, that could be one of the reasons why. Okay. You got to get going. You got to get out there. So Chan is available to help you with your events, right? But he's not going to wake you up and say, hey, let's go do events, right? It's really up to you to, first of all, find these events. Okay. So I'm going to talk to you about that this morning. And very, very simply, I'm going to pick on my best friend, Google here. And I typed in events Orlando. Okay. Very simple. There's tons of calendars and things that are going on, events in the weekend. Here's the community calendar from WKMG. This is a news station here in Orlando. All the news stations have these kinds of links. And you can see what's going on this next week coming up, right? Anything interesting that piques your mind, you can see what's going on across your area, okay? You're not always going to have some wins here, but I am going to show you that I picked up on, just very quickly this morning before the call, Orlando Sentinel. So I opened that up, and here's one. It's a Spirit Fest, Holistic, Metaphysical, and Wellness Expo. They've got crystals and spells. No, I'm kidding. I don't know. But it looks like it's up that alley. But I don't know. Maybe there's no agents there. Health insurance is still top of mind, even for those folks. So there's an event for you. That's on March 2nd and 3rd over the weekend. I mean, I took 2 minutes to find that event, and there it is. Also scrolling down, I think I saw a. Let me see. There was another one in here. It was a senior Olympics, I think, in Polk County. If you type that in, you could find. I mean, there's stuff all happening all across wherever you're at. So this just took me a couple of minutes. Here it is. 2024 Polk Senior Games in Polk County in Bartow. Okay, any of you work in Polk County? I mean, senior games. There's your Medicare folks right there. And look, guys, it literally took me 2 minutes to find 2 awesome events where I can get, 10, 20 leads by just putting a little bit of elbow grease in there. Okay. Now you found your event. What do we do next? Okay. The next thing to do is you got to report the event or let us know that you've got an event going on. And we've got an event request form. And very simply, you just pop in the information here. I've shared that with you before, the event request form. If you have an event and you need help with it, very simply send us an email at support@askhpm.com and we'll get you connected to a manager here. The next thing you'll notice on the table that Rose has, and I'm going to pull that picture up for you guys to see again. Right here, she's got her flyer, and it's just one flyer. She's got her business cards in there. But on that flyer, you can't see it there, but there's a QR code as well that you can use. But she's got flyers, she's got business cards, she's got marketing materials on her table that are customized with her picture, her name, her phone number. And here's where you get it. We still have our marketing catalog. You can peek through, and all of these assets are already pre-built. They're ready to go. Everything from flyers to postcards to business cards to Facebook ads to posts. We've got presentations in here. We've got pull-up banners. I mean, you all have been busy, and we've created these templates and shared them so anybody in here can come and swipe a file and get ready and get busy. Okay, tons and tons of resources. I thank Casey for putting all of this together and helping out with getting those assets created. So once you have your assets created and you're out there, let us know and we'll connect you with Chan, who can help you set up the event. Tents, tables, tablecloths, giveaways. We'll coordinate the flyers to be printed for you so you have them in hand. We can do everything except get you to that event. We can do everything except you finding the event. You got to find the events. You got to go looking for these events. And obviously we can't, gather leads for you. That's your job, right? You've got to learn how to gather leads out there. And then also, don't forget about these provider groups that we've been working with and introducing you to. And those of you that have bumped into some of these doctor groups, like last week we met with Centerwell, I hope you're taking advantage of their time and really meeting with them and getting a strategy together, right? If you're not putting together a strategy and partnering up, you don't have to partner with everybody, right? You don't have to, but find the good partners. Find the ones that are responsive, the ones that are really interested in working with you, and think. If you have 2 or 3 really good partners out there that are like, hey, I got an event, you want to come with me? And you share that together. It's exactly what I used to do as an agent. I would find a couple of people that were out there doing the same thing I was doing, and we'd share info. We'd say, hey, look, I found this event. Are you going to be there? No, I didn't know. All right, come with me. And they would do the same thing back for me. And it was everything from health fairs to craft shows to birthday party celebrations, whatever it was. I would always try to bring my partners in there to help me out, whether it was from a provider group or a carrier. We all kind of worked cohesively in that manner. So find your partners is a big part of it. Get your events out there and get ready today, because that's what it's really, really all about. Okay. So speaking of partnerships, we've got a very important partner on the line, and I'd like to introduce Gold Kidney. I think Katie is on the line. Can you?
Hi, everyone. Can you hear me okay?
Yeah, we got you. Good morning.
Good morning. That was a really smooth transition, Justin. I just want to tell you that was good. But
I've had a little bit of practice. Thank you very much. Well, if you could take a few moments and introduce yourself to the class and tell them all the good news about Gold Kidney.
Sure, definitely. Good morning, everyone. My name is Katie Stroud. I'm the sales director here in Florida for Gold Kidney Health Plan. First of all, I just want to thank Justin and HPM for having us again today. Just so I kind of have an idea of our audience this morning, if you could use your reaction button at the bottom, can you give a thumbs up if you were here for my last morning presentation? I know Rosie knows all about us. Hi, Rosie. Or no? Okay. So, we have a couple. Good. Well, we have a few minutes, and if you know me, I talk a lot. So, these presentations are always a challenge, but what I'm going to do this morning is really just give a brief, I'm telling myself that, a brief overview about Gold Kidney Health Plan. What we have to offer here in Florida, and I'm going to urge you, if you have any questions or need more detail, we're going to be providing information of our market managers here in Florida. Please follow up, and we're happy to meet with you one-on-one just to talk further. So when we first came on to this call, and in general, it was our first AEP in Florida, and we came a little late in the game. I just started back in July. So we're really fortunate that we've created a lot of great agent relationships. But when we came on, you guys were focused on getting off the ground for AEP, right? So you couldn't really focus much on what we had. So right now, AEP is over. Like Justin said, you're in the middle of OEP, moving into SEP. and looking to grow your business year round. And that's something you could do with Gold Kidney Health Plan. If you remember, we have a full portfolio of Medicare Advantage plans. We can help anybody on Medicare, but we have a really high focus on providing chronic special needs plans, or CSNPs. And as you know, that's a year-round growth opportunity for you all. So again, today I'm going to give you a very quick refresher. And then last time all I did was an overview. We're going to talk next steps. And that's why I love what Justin was talking about. And I love everything he said, by the way, because a lot of times people be like, well, how can I go out there and find individuals for these CSNP plans? Get out there in the community, do some grassroots events, do some marketing, and talk to living, breathing human beings, because 1 out of every 3 of them have a heart issue or diabetes and qualify for our plans that we're going to discuss today. So what I'm going to do right now, and I also have real quickly, I have one of our market managers on and one of our pacers, which is our outreach reps. I invited them on. They deal more in the, you'll see a map, but the west side of Florida, because that seems to be where more of our interactions have been, like with Miss Rosie Paulson, who we appreciate very much. And we want some more Rosies. I don't know if it's possible to be another Rosie, but we want agents like Rosie to work with. So Justin Hall, are you on this morning? Justin?
Yes, ma'am.
Do you want to say hello?
Yes, hi. Yes, Justin Hall, West Florida. So I'm in charge of Hernando, Pasco, Pinellas, Manatee, and Sarasota. I've been in the industry for almost 7 years. I was an agent, so I think a lot like an agent does. And then I worked for an FMO as well. But I'm going to keep it short because I'm looking forward to hearing what Katie has to say next.
Well, you might say a few things too. Surprise. I'm just kidding. I'm bringing up the presentation right now. Bear with me, please. And you know what I'm going to do? I'm going to turn my camera off, because then hang on a sec. Bear with me.
You got it. And I know you're going to go through the areas, guys, but Gold Kidney is one of the plans that is available on HPM Shop. So we asked and they delivered on that. So we want to thank you for that through Connecture. So makes our life easy.
No, that's wonderful. We love that.
Yeah.
So right now, so first of all, this is our Florida sales team. Okay. I'm the sales director. I oversee Florida, been in the industry for a long time. Started as an agent, worked with United, Humana, and now I'm here at Gold Kidney. And I'm really grateful for that, because my favorite plans, I have a social work background, if you don't know that. So my favorite plans have always been special needs plans, because I love, we're helping people that need it the most. So you're going to see a map in a minute, but who you see up on the screen right now, these are our 3 market managers, and we can send you their information afterwards. Justin, he really works on the west and then central part of Florida. Ray Gomez is down in southeast Florida, Broward and Palm Beach, and then Miss Daneria Kamore is up in Jacksonville, the North Florida area. Anytime, I know a lot of you are in Orlando, but I know you work all over Florida. If you have questions in these different markets, reach out to the market managers. They are here to help you, educate, strategize, whatever you want to do, they're here for you. In a little bit, I'm also going to introduce our pacer, Dorian, to talk about grassroots marketing. So this is our footprint as a reminder. We've been in Arizona now. This is our 2nd year out there, if you do any business out that way, but we really focus in Florida. The Golden Counties that's our service area in 2024. So our members can use their plans as they travel, wherever they go, but they have to be a permanent resident in one of these Golden Counties to join. There's 9 of them. Giving you a peek in the box, because we're already obviously really thick into conversations for 2025. We are most likely going to be expanding into 15 more counties in Florida. Counties like Citrus, Hillsborough, Seminole. We're looking at Osceola, Miami-Dade country, which is scary, but I think we're going there. So it's all about growing our provider network. And that's why I'm not sure about Orlando yet, because we really need Advent on, we believe, to kind of move into that area. But we'll keep you posted. But this is where we're at now. And we're going to be growing throughout the state in 2025. About 1.7 million Medicare eligibles in these golden counties. 30% have a chronic condition that would qualify them for one of our C-SNP plans that you can offer year round. So not going to read this to you, just going to summarize. As a reminder, Gold Kidney Health Plan. We are headquartered in Scottsdale, Arizona, beautiful area. It's our second year out there. Gold Kidney Health Plan offers a full portfolio of Medicare Advantage plans, again, helping anybody on Medicare. But our plan was developed by a group of 100 nephrologists and specialty doctors throughout the United States. The story is, and it's a true story, they meet with patients every day that have chronic illnesses, specifically CKD or chronic kidney disease. Some of these people were on dialysis. Some people are not on dialysis, but they're struggling with their illnesses, and they just can't afford their care. High copays, frequent copays to the doctor, paying 20% for dialysis. Many people, if they go to the doctor a lot or go to dialysis 3 times a week, don't have transportation that's reliable to get there, and they end up in the hospital. It's just a really bad cycle. So what they did is they came together and developed Gold Kidney Health Plan. These are what we call specialty Medicare Advantage plans that are really tailored towards individuals with chronic illnesses like CKD. They have low and affordable co-pays for the services they use the most. Access to care was very important. We limited a lot of prior auths on this plan because the doctors know what their patients need, and also added a lot of additional benefits on to address struggles with other social determinants of health like transportation. So this is a newer slide here, and I like it because it kind of opens your eyes. Per CMS, there is no specific C-SNP plan for CKD. However, they allow carriers, if they opt to have chronic special needs plans for individuals on Medicare with end-stage renal disease, or now they call it ESKD, end-stage kidney disease. So at Gold Kidney, we do have a C-SNP plan for ESKD patients. We also have C-SNP plans for individuals that have the conditions that go hand in hand with CKD, and that's cardiovascular disorders, CHF, and diabetes. Diabetes oftentimes leads to members needing dialysis if it's not under control. If people have CKD, there's 5 stages. As they progress through those stages, they often develop heart issues. So the things on the left-hand side of your screen all go hand in hand with CKD. So we really try to develop plans to help slow the progression and improve quality of life. So as an agent, this is a year-round selling opportunity for you. Up on the screen here, this is really focusing on individuals with Medicare that also require dialysis. In the state of Florida, that number grows often, unfortunately. But there's about 40,000 individuals in the state of Florida on Medicare that require dialysis. Throughout the United States, there's only 13 C-SNP plans available in 13 states aimed at individuals with end-stage renal disease. The crazy thing is there's less than a 1% enrollment rate on those plans. And people say, why? It's because they don't know the plans exist. And that's why to get out there at a grassroots level at these events and just be in the community, even working with providers and dialysis clinics to educate them, that's where we can help people and also grow your book. And by the way, we're contracted with DaVita, US Renal and Fresenius, and many more dialysis clinics. In that 9-county service area, we have over 100 clinics in network. Again, you're looking, for these C-SNP plans, we have the C-SNP for Medicare and on dialysis, ESRD. We also have a separate C-SNP plan for individuals with diabetes and heart conditions. And again, you just go out in the community, do events. 1 in 3 seniors you talk to or adults is going to have cardiovascular issues, and just as many with diabetes. So really just trying to meet people, let them know these benefits are available. Real quickly, we do have a full portfolio of Medicare Advantage plans. They're all HMO point of service, no referrals required, point of service means there's an out-of-network benefit available for every benefit on the plan. So a person can go in network or out of network and pay the same cost share. The key is on any Medicare Advantage plan is contacting that out of network provider at the time of enrollment to make sure that they're willing to bill a Medicare Advantage plan out of network. You probably saw the announcement, but the biggest group we've added recently, our network is always growing, is MyCare Medical. They have quite a few locations in the greater Tampa Bay area, so we're excited about that. But we have our Super Plus plan. That's a C-SNP plan that has an $150 Part B give back, and that's for individuals on Medicare that have heart issues or diabetes. As you can imagine right now, 90% of the enrollments coming in are this plan, Super Plus. We also have what we call Super Complete, which is really, again, a C-SNP plan for those same conditions, but designed for people that are full Medis. Dialysis Plus is a plan that we should be doing better on because it's a no-brainer. This plan covers dialysis at no cost share. With other plans, standard MAs, they're paying 20% and meeting their MOOP. The 0 cost share for dialysis and unlimited transportation are the two key benefits on this plan. Dialysis Complete is for individuals with Medicare on dialysis that also are for full Medis. So those are our C-SNP plans. If you look down, we also had a fair share of enrollments into what we call our Honest Care plan. And that's just our standard MAPD plan. But it does include the $150 give back and some very rich benefits. So if you have a T65 or just someone that's not chronically ill, the Honest Care plan is a great option. We also have the Loyalty Care plan. That's our MA only plan. It does have the $150 buy down and really rich benefits. So I don't think I have time to go through all of this, but some things that make us different. We not only have $0 PCP copays on all of the plans I just mentioned, but we also have $0 specialty copays to nephrologist, cardiologist, and endocrinologist. And those are the doctors that our members tend to see the most. Any other specialty provider would be a $10 copay. As I mentioned, $0 for dialysis on our plans. Insulin is covered at $0 all year round. It's a tier 6, brand name and generic on all of our plans. We include a healthy food benefit, dental, vision, hearing, transportation of some sort on every plan, OTC, fitness, meals. So these are just some of the common factors on every plan I just mentioned. If I could tell you one more thing, because that's about what we have time for, it's about our drug coverage. The drug coverage I discussed right now is available on all of the plans in our portfolio. You'll see we have 6 tiers. Again, tier 6 is insulin covered $0 all year round. We also have gap coverage for tiers 1, 2, some of the drugs in tier 3 and tier 6. If individuals use our mail order, they can get, sorry, I'm just looking at my text here. I thought I received a text from the chat box here, but mail order is one copay for an 100-day supply, which is unique. What I really want to point out though, and I'm going to try to make this bigger, if you have clients that you can think of that you've already met with that are on tier 3 diabetic medications, Farxiga, I can't pronounce half of these sometimes, Jardiance, Ozempic, Trulicity, these drugs cause most individuals to go in the donut hole within 3 or 4 months. So usually around March or April. With Gold Kidney Health Plan, before the donut hole, our members pay $40 for an 100-day supply of these meds, which is crazy. But what's even crazier is when they hit the donut hole, these are covered through the gap. So they only pay $12 for an 100-day supply of these meds through the gap, which is insane. We have agents call us and say, is there an error on the Medicare, drug calculator? We're like, no, it's real. We want our diabetic members to take their meds all year round so they don't end up in the hospital. So this is one thing that really sets us apart. with our plans. Dorian, are you on right now? Escalante? Or Dorian? No. I was hoping.
Yes, ma'am. Good morning.
Okay,
I'm here.
good. Dorian is our PACER. We have an acronym for everything. I like this one. It's Provider and Community Engagement Representative. And Dorian's job is to get out there in the community, make people aware of Gold Kidney, but also work with brokers to create grassroots type opportunities. Dorian, do you want to talk about a little bit of how you can work with the brokers on this phone and what we have available?
Yeah, so my job is the provider and community engagement representative. I do a lot of grassroots things. We do a lot of different kind of events. So we do small events to where we'll do like coffee and seniors at the senior centers with the Medicare population. We'll do like a lunch and learn. We'll do bingo. We actually just came back from the all kidney patient support group over the past weekend. It was a really cool, fun event. We had a game night with them. But we're just trying to get in front of as many people as we can and inform them because we are a relatively newer plan. So a lot of people don't really, they see our name and they're like, what's that? So we want to put as much educational stuff in front of people and make sure they're aware of who we are and what we do. And that starts with the community and doing what we're doing in grassroots marketing and the senior centers and the senior expos at the food banks, at churches, at resource fairs. So that's my job. If you guys ever have any questions, if you ever see anything that would interest you and you would like to collaborate with, I'm all ears, and I would absolutely love to partner with anybody.
Thank you, Dorian. And that's, with Dorian, it's kind of cool because he does what Justin was doing. He's in the community searching, online, looking for events and opportunities. And then we partner with agents to staff them. Rosie's been great, and we appreciate it because it seems like we have more events to staff than we have agents available sometimes because we're newer.
Mhm.
So we're really looking to partner, but then also, like Dorian said, if you have your own events, like I saw Justin Jacobs, sorry, I have to say Justin Jacobs because we have Justin Hall on too. But I saw Justin Jacobs had that event form you all fill out. If there's an event where we can sponsor, kind of like the WellCare one at the beginning, we have a budget to sponsor events if you fly our flag there as well. So we would love to work together. We have marketing materials like you see up on the screen, many more that we could customize with your information, banners, everything you would need, as well as just event flyers. If you're doing something at a senior center and you need to advertise it, we have materials available to kind of help with some of that stuff. So I feel like we used our full time, but I want to thank you for having us and reach out. We want to work with you. We want to help the community together, and we want to help you grow your book of business. So
Katie, phenomenal. Thank you very, very much. Very thorough. And guys, those of you that are on the phone and not on the chat, I'm just going to kind of summarize some of the questions that were in the chat here this morning. Justin, Denaria, Ray's contact information is in the chat. And then also Dorian's contact information is in the chat as well. If you need if you're on the road right now and you're just taking this call, just send us an email at support@askhpm.com and we'll connect you to anyone at Gold Kidney. So don't worry about that. The question was, do I have to certify? Absolutely. This is an official Medicare Advantage plan contract, so you do have to certify. Justin's saying that he can get through certification in 20 to 25 minutes.
It's so easy.
He's a whiz kid, but he's right. I will tell you that I got through it in about 20, 25 minutes, and it was very insightful. I actually learned quite a bit about ESRD and that training, so it was very nice to see that. Also in the chat, Justin had mentioned that, and you might need to expand on this a bit. It says, any providers you work with, please let me know. We will have our network team reach out fairly quickly. Also, we allow brokers to put a non-participating PCP on our application, and
Very
Gold Kidney
good.
will reach out to work with the provider to get them in network. Can you expand on that? Because that
Can I
might
expand
be,
on that? Yes.
yeah.
Couple things there. Number one, the first part, if you go on our find a provider on our website, you'll see we have quite a few providers in the 9-county service area. We have just over 17,000. However, everyday agents are like, why don't we have Dr. Joe Smith in the network? If something comes up where you want to suggest a provider for us to add, if you send it to the market manager in that area, the provider team will reach out to them within 48 business hours and try to contract them. What Justin is saying, for the second part of that, all of our plans are an HMO point of service, meaning for every benefit, including primary care, our members can go out of network and pay the same cost share. So on the enrollment application, when you're filling it out, if it's a non-par PCP, you just put non-par on there. And what happens, we see that come in. Our enrollment team, when they see that, will reach out to the non-par provider and kind of just smooth over how billing works out of a network. But what I will say is before you enroll that person in the plan and put non-par on there, you want to reach out to that provider in advance and make sure they are willing to bill our plan or a Medicare Advantage plan out of network. Otherwise, that could result in member dissatisfaction and rapid disenrollments, which nobody likes.
Perfect. Thank you for clarifying that. We have been in sticky situations like that, so we appreciate that. Like you said, Gold Kidney and what you're sharing is you guys have marketing materials. You're willing to help sponsor events. You
Yes.
have people out in the community. You've got more events than you know what to do with. And here we are. We got agents that are ready to get busy. So guys, get busy. You've got what we were talking about at the top of the call. I wish I knew Dorian when I was out selling because he's doing he's out there doing the hard work, finding events, getting them set up, getting everything that you need, and even help paying for it. That's awesome. So yeah, thank you for sharing that with us.
Sure.
Absolutely.
And follow us on, if you're not already, follow us on LinkedIn. Dorian posts a lot of what he does, so you can kind of see, what's happening in the market.
Oh, great.
It's cool.
Yeah, appreciate that. And then lastly, I just want to touch on a couple of points. Like you had mentioned, only less than 1% of ESRD patients are enrolled in a CSNP plan that can service them, like Gold Kidney. And I remember as an agent, we would steer clear, and this is a while ago, right? We would say, whoa, you're fine where you're at. I'm not gonna mess you up with ESRD. They're on dialysis. Things were always really sticky with those members. So it's really nice to know that if you bump into somebody like this, you actually have an option for them now that's specifically designed for people that are on dialysis, that have kidney failure, which no one else is servicing. This is a reason why we contracted with Gold Kidney to give you guys an option. And then lastly, you kind of hinted at it, the opportunities at dialysis centers and nephrologists are places that the normal agent doesn't really go. They're always, you guys are like stacking on top of each other to get into PCP offices. Meanwhile, these places are wide open to work with. So just wanted to leave that point, and maybe if you want to expand a little bit on that, Katie.
Sure. No, provider marketing is huge. The dialysis clinics, it's just getting in there and trying to talk with the social workers, which isn't always easy. It might take multiple attempts, but yeah, endocrinologists, cardiologists, nephrologists. I think they would be very interested to hear about the drug coverage too on our plan, that they could be helping their patients, with just even taking their meds year round and being able to financially do that. So yeah, provider marketing is extremely important. And that's where I know Justin Hall and Dorian, or if it was Ray in South Florida, Denary up in North, they're happy to meet with you guys. And they have been doing one-on-one meetings. And the goal is to, after an hour or two, come out of that one-on-one business planning meeting with not being a floodlight, but coming with 3 specific approaches that we're going to support you on in the community to market our plan. You got to come up with specific approaches, and we'll help you with that.
Very cool. Nick, you had your hand up. Did you want to add something?
Yeah, that's great information. And truthfully, guys, if you have a PCP that you are very familiar with and have a good relationship with, this is that question that we've talked about in some of the trainings that I've done with Justin, is asking them, hey, who who do you send your diabetic patients or your heart failure patients or your renal patients to? Who's the nephrologist that you use? That helps open up. I said diabetes, sorry, but that's opens up the dialogue with that PCP, and they can normally get you in to that social worker or to that office a little bit easier if they think you're going there to help them grow their business. So use your resources, and if you need help with that, let me know, and we can help you have that talk a little bit easier. But by asking their referral coordinator in your PCP's office that you know, what nephrologist do you use? What cardiologist do you use? Can you make a call and say, hey, I got to come over and show them this new plan? Or if they already have the plan, it's another lead source for you.
Thank you, Nick. Nick's been so good too. I think he really understands the value. He's been helping us a lot, but no, that's all good. And then the agent in greater Tampa Bay area, I should have thought of this, but he's like retinal specialists. People with diabetes are always at the retinal specialist. So there's just a lot of different avenues you could take.
And then Miss Rosie has a question or a comment.
It's more like a little comment as an agent. It has been very easy to work with Gold Kidney. So everything that they say they're going to do, I tried. I have a doctors that I have put on the system, and it was really easy to do. When I have events, Dorian is available. I actually always shoot him up with all the events that I find. And then we figured out what agents are going to get there. Justin, and this is funny because you just had this problem one time, Katie, but I'm had Justin Jacobs, Justin Hall, and I deal with every single
day for you. Yeah.
You can call me JJ. That's easy.
Has been available when I call. I think I have driven him insane a couple of times, but he hasn't yet. So those are the things. And the latest thing that I do want to say is you guys wanted a point of view from one of a client of mine, and two of my clients went to your meeting, and they came back so thrilled. So I just wanted to let you know that I usually do not certify with a client with a plan that starts the first year. But I did to give it a chance to see how much you're going to pull through and do what you say you're going to do. And you did. So I just wanted to give you guys thumbs up as an agent point of view that you have pulled through with everything that you say you're going to do. And I can't wait for 2025.
Well, same here. We have some exciting things, I think, happening there. So thank you. Thanks for everything, Rosie.
Awesome. Thank you guys for staying a little bit over here this morning. Again, if you are jammed up with calls or client visits, remember these calls are being recorded and hosted on YouTube. And in case you need to get there, just type in YouTube Healthline Markets, and you can revisit these chats as well. So Katie, Dorian, and Justin, thank you all for being on the call this morning. We appreciate your time and attention and sharing the good news about Gold Kidney.
Thanks, guys. Have a great day.
Fantastic. And you got it. And lastly, if you want to get contracted with Gold Kidney, if you're not currently contracted yet, send an email, contracting@askhpm.com, and we will get you started there. Very, very easy to get that going. So thank you all for being on the call. We will see you next week. Have a fantastic and productive week. Take care.